Hi, welcome back to my channel. Today I would like to go over quality improvement in healthcare. So in this video, I'll do a comparison of quality improvement, evidence-based practice, and nursing research. On the PMHNP exam, there are a few questions that come on quality improvement, asking about PDSA, PICOT, and scientific method. And I wanted you guys to understand what scenario and what situations we use PDSA versus PICOT and scientific method. So I'll start off first with quality improvement. And what is quality improvement? It is evaluating the efficacy of nursing interventions and making recommendations for future improvements in terms of quality, clinical outcomes, and cost effectiveness. It's not designed to create nursing practice standards or nursing science. The purpose of it is to immediately improve care in a specific setting and to evaluate a company in relation to standards or benchmarks. It helps to raise cost effectiveness and to improve process efficiency and effectiveness. So how does this impact on practice? Well, it enhances patient care procedures. It helps to look for ways to improve processes in the units and organization. It incorporates the knowledge. In order to do quality improvement, we can use the method called PDSA, which stands for Plan, Do, Study, Act. You can also use something called PDCA, which is Plan, Do, Check, Act, or Six Sigma. But for this test purposes, for the PMHNP exam, we'll only really focus on PDSA. PDSA Cycle. PDSA Cycle is shorthand for testing a change by planning it, trying it, observing the results, and acting on what is learned. It is the 4-step process for implementing change, solving problems, and continuously improving processes. Because of its cyclical nature, it can be used indefinitely for continuous improvements. So let's take a look at Plan, Do, Study, Act. First step is plan. This is where you set goals for improvement, you predict what will happen. The plan is to establish the issue, focus on the change that needs to be made. You're creating a multidisciplinary team. You're creating a statement of what you want to plan to do and what you hope to accomplish. This is where you would establish specific steps to take and how you will assess your progress and the outcome. The second step is do. Carry out the plan, document any problems encountered and observation. You're gathering data, you're implementing your plan. This is collect data as you go. Let's take a look at the third step, study. You're fully analyzing and comparing data predictions and examining learning. This is looking at all the data you've collected, interpreting to see if you have achieved your desired results. You're using tools such as charts and graphs to help visually evaluate outcomes and trends. This is when you would consider what you learned from implementing your change. The fourth step is called act. If your change you implemented was successful, you can standardize this method and begin to use it regularly with periodic evaluations to make sure it is still successful. Now, if your change did not get the results you wanted and a different approach may be more successful, return to step 1, which was plan, and using what you have learned to develop a new plan and complete another cycle. You might be thinking, why is PDSA an ongoing process? Well, there is always room for improvement. Each time a PDSA cycle is completed, the organization will become more efficient. Just because something is good does not mean it can't be made even better. Quality improvement can use the PDSA cycle, and examples of these cycles and the results would be such as reducing ER patient wait time, reducing ICU patient boarding time, or possibly reviewing how nursing measures vital signs and data entry accuracy. So now let's take a look at evidence-based practice. Evidence-based practice is a combination of the most recent clinical research, evidence, patient values, and clinical expertise. It's a scholarly and systematic problem-solving model that results in high-quality healthcare delivery. The purpose of evidence-based practice is to incorporate research findings into practice. It's to help improve treatment efficacy. It's to promote non-traditional based practice and encourage practice consistency. It helps to utilize an interdisciplinary approach in practice. What's the impact of evidence-based practice? It's to improve practice or the technique. It aims to have a positive impact on the practice. It also translates the knowledge. In evidence-based practice, the method that we use is called PICO or PICOT. So let's take a look at what PICO or PICOT stands for. P is for population or patient problem. Who is your patient? What are the disease or the health status, age, race, or sex? Be specific. I is for intervention. What do you plan to do for the patient? Be specific with the tests, the therapies, or the medications. C is for comparison. What is the alternative to your plan, such as no treatment or different types of treatment? O is for outcome. What outcome do you seek? Less symptoms, no symptoms, full health, and so forth. T can be type of study or time. What is the time frame? This element is not always included. Examples of evidence-based practice projects would be, for example, best pain medication for headache. Is it IV Tylenol versus PO Tylenol? Another example would be, what is the best practice to avoid pressure ulcers? Another example would be, does the evidence say that manual blood pressure versus automatic blood pressure as the most accurate? Which one is it, manual blood pressure versus automatic blood pressure? And last but not least, let's look at nursing research. Nursing research is a formal, systematic, and rigorous inquiry process that is used to generate and test theories about the human being's health and related experiences in their environments, as well as the actions and the process that used by nurses in practice. It's a systematic research that is designed to generate and contribute to new knowledge that can be generalized for wider application. The purpose of nursing research is to answer the research question. It's to test the hypothesis. This is when you would describe, explain, make predictions, explore, or discover. This is where nursing research disseminates the research findings through activities such as presentations, publications, consultation, and journal clubs. What do I mean by disseminate or dissemination? Dissemination is the act of spreading something, especially information, widely. So the growth of the nursing profession depends on the ability of its members to build and share a body of knowledge. Without dissemination, there would be no evidence-based practice. I know on the PMHNP exam, they like to throw in the word disseminate, or dissemination is part of the question, and it can get confusing for some people. And there are 3 types of dissemination. They want you to know which one is the highest level and which one is the least, right? So here we go. First one is presenting at local, regional, and national conferences. The second one is publish in peer-reviewed journals. Third is publish in professional newsletters. Remember, dissemination is the act of spreading something widely. So when I gave you those 3 choices, disseminating, spreading posters, spreading papers or presentation, know which one spreads widely the most, okay? The impact of using nursing research on practice is to generate new knowledge for the practice. It seeks to add to the professional literature. Guess who used this process? Florence Nightingale used it. She used continuous quality improvement. She focused on how to improve quality and to be continuous with it. It does not stop when the standards are met. It uses evidence-based methods for gathering the data and achieving the desired results. It involves evaluation, actions, and mindset to strive constantly for excellence. Nursing research method uses scientific method, research question hypothesis methods, interpretation of data, implications for practice, dissemination of findings. You can also use qualitative research or quantitative research. Some of the examples of nursing research can be seen in projects like, for example, a 3-year study that looked at symptom clusters in congestive heart failure patients, or a study that shows, does a review of literature reveal a need for new blood pressure management information? So let's just recap. I want you to remember quality improvement, you use the method PDSA. When you see a test question on quality asking you about quality improvement, what's the method that you use? PDSA, Plan, Do, Study, Act. Any question that is going to be asked on the NP exam regarding evidence-based practice, you're going to use the method PICO or PICOT. When there is a question on nursing research, this is when you would use the scientific method, qualitative or quantitative method. Also, from takeaway from this video, I want you to know the word disseminate. It's so important on this test questions. There is test questions on that, so become familiar with that. So before you click out from this video, let me remind you, the whole idea behind this video is not to just tell you what to focus on for the exam, but I want you to become an NP with knowledge no matter where you go. Remember, knowledge has a beginning but no end. With that being said, click like, click share, and subscribe to the channel.